live. Morning, ladies and gentlemen. I'm here with Dr. Iggy Ray from the from the Health and Human Service Department, and he's here to discuss with us the recent events in Western North Carolina with Legionnaires Disease. How you doing, Doctor?
Hello, how you doing?
Absolute pleasure. Nice to have you here.
Yes, sir.
Now, Doc, let's get straight to the point. Tell us about Legionnaires Disease. Exactly what is this?
Well, Legionnaires Disease is a kind of severe pneumonia caused by a type of a bacteria called Legionella. This type of bacterium is found naturally in freshwater environments, but it can also be like lakes and streams, but it can be a health concern when it grows and spreads in human-made buildings like water systems like, let's see here, shower heads and sink faucets, cooling towers, hot tubs, fountains and water features, hot water tanks, and heaters, and large plumbing systems. The one that happened in North Carolina was caused by hot tubs in the State County Fair. Apparently, since October 16 that it happened, North Carolina public health officials reported 141 cases because of this case stemming from this hot tub incident.
Wow.
Now, they're not dipping in these hot tubs. It's something else. It's an air droplet disease, and it had caused this. 141 cases had been confirmed, and they've been hospitalized, and 4 had died.
Wow. Wow, that's sad to hear. So I mean, I think we should educate the public and give them a little bit better
Most
idea
definitely.
of what it is and who's at risk. Now, as far as who is at risk, are there like indicators or I guess situations that would make an individual more at risk or more prone to being able to contract Legionnaires disease?
Sure. People who are the elderly population is at risk. Current smokers, current and former smokers. People who had cancer treatments, underlying diseases like diabetes, kidney failure, and liver failure. Basically, these are people with weak immune systems or can be compromised with the disease. Me and you, healthy people, we can fight off this disease easily. It's everywhere, but unfortunately, for these type of subgroup of population, they are at risk.
Wow. So for members of our audience in there, how would one know if they have Legionnaires disease, or they've been exposed to Legionella? Are there symptoms or things we can look out for?
The regular symptoms would be flu-like symptoms for now, and that can progressively get worse. But indications for symptoms initially would be coughing, muscle aches, fever, and shortness of breath, and headaches. The shortness of breath should be a
good indicator.
Indicator as well, because it's a pneumonia-like disease.
Now, if a member of our audience is out there experiencing this, what would be the first option? I mean, is there, medicine they can take? I mean, what are the treatment options?
Sure, it's treatable. Once it's discoverable that you have it, it's treated by antibiotics, and unfortunately, 1 out of 10 people who gets Legionnaires can die.
Wow. And
infection.
So 10% normally that's hospitalized normally dies.
Correct. Unfortunately.
Well, wow. That is very, very disturbing news. Now, with that being said, so what is it like here in the United States? I mean, what's the magnitude of the disease here? Because a lot of people in our audience, they're not really familiar with Legionnaires disease. And for those who are not, we like to let them know how prevalent this is in the United States,
Sure.
how much of an issue it is.
Sure.
Give some more information on that.
Okay. There's an estimated about 8 to 18,000 people are hospitalized for this disease every year in the United States. Just to make it easier as well, I found another report data from the management of Legionella in water systems estimates that 52,000 to 70,000 Americans suffer from Legionnaires disease each year. An incidence rate's about 10 times higher in a number of reported cases. But Legionnaires disease affects and kills more people in the United States than any other reported waterborne disease. I can give you some CDC numbers as well, if you may. if I may, during the 2000 beginning of 2000s, cases of Legionnaires disease in the United States, reported by the CDC, increased 279%.
Wow.
From 1,100 cases in 2000 to 4,200 cases in 2011. Now that's basically 8 years ago. Now it's increased, so that number has significantly increased as well. During the same period, the national incidence of Legionnaires disease increased 249% from 0.39 per 100,000 people to 2,000 in 2000, so to 1.36 per 100,000 people in 2011. So from 0.39 per 100,000 to 1.36 per 100,000 people in 2011. So that number had also increased significantly.
Wow, that's incredible. Now, I mean, considering that, I know you public health officials use these fancy terms to basically help you anticipate and prevent these situations like social determinants, etc. I mean, considering these numbers, can you give some idea what some of the determinants are, the social determinants that would basically create this change or this influx in prevalence?
It does, even though a lot of people in our scientific world says that identifying the source of bacteria is not equivalent to uncovering the cause of disease. Meaning there is more to it than just finding what bacteria causes what disease. Basically, there are factors that causes the spread of the disease. For example, back in 2015 in New York, in the Bronx area, there was been an outbreak as well of Legionnaires disease there. It showed that there was Legionnaires in both affluent and lower social economic areas, in the dense areas, in both their dense areas. But it showed that individuals in the South Bronx had a higher risk of having compromised immune system, and the elderly population in the lower socioeconomic status, which is a factor, and that had had a statistically more exposed to and compromised to this harmful harmful environmental toxins.
Oh.
It just so happens no one was sick in the wealthier areas, but unfortunately in the lower socio-economic status areas, more were affected.
So basically, you're saying that lower income individuals, due to lower immune systems because of unhealthy diets or just living conditions.
Correct. So I can add to, because of the lack of availability of healthy food choices, poor air quality, access to medical care is a factor, and of course these are enormous burden that can stress the financial and social inequalities that they have, that places vulnerable populations as such.
Oh, so now I know what your fancy terms like social determinant means. Okay, that's education. I'm sure our audience appreciate that definition also. Now moving forward a little bit there, Doc. Are there any strategies you guys have in place to basically tackle this situation?
Correct. According to CDC, even though it is a treatable disease, there is no vaccine. It's not curable. Okay. Currently, right now, for the Legionnaires disease. Mm-hmm. But the key right now is to prevent this disease from happening, is to make sure that building owners and managers maintain building water systems in order to reduce the risk of Legionella growth and Legionella spreading. Basically by improving building water systems that might grow and spread Legionella. Of course, as I mentioned before, improving how hot tubs, hot water tanks and heaters, large plumbing systems, cooling towers, and decorative fountains must be regulated. Because the CDC says that Legionella can often be prevented with effective water management planning with these places. There's some different strategies as well, if I can divulge more.
By all means, I'm sure audience will appreciate it.
Strategies that facility managers can use to prevent Legionnaires disease as well from occurring from healthcare facilities, or as an example saw here is building a team focused on keeping the facilities water safe, creating and using water management program to limit Legionella and waterborne disease, water germs from growing and spreading, and working with healthcare providers to identify Legionnaires disease cases to early and determine those cases may be associated with healthcare facility. We're reporting Legionnaires diseases cases to local public health authorities quickly and working with them to investigate and prevent additional cases.
Okay, Doc.
It's too long.
No, we appreciate it, Doc. Now, in your research and your experience, how effective are these strategies?
Now, these are we have been working with these for a while, but I believe the strategies are working. They've been effective, but more must be done. According to I found an article here from the National Academics of Science, Engineering, and Medicine this past August, titled "Stronger Policies Must Be Needed to Protect the Public from Legionnaires' Disease." Shows that the U.S. needs stronger policies and guidance to combat this disease. Currently, there's an absence of regulations that can broadly control the presence of Legionella in our water systems, partly because state health officials is basically the key to prevent this disease. Since regulations are needed for facilities to implement the water management program, state officials hold the key to preventing Legionnaires' disease, since there are the entities most likely to regulate. The CDC won't establish regulations because they only has influence, but they don't establish regulations. Basically, that's law. So the U.S. environmental, the EPA, if you know that, they are
Environmental Protection Agency.
Yes, they focus on water distribution up to the street level, street tap. Not only on the system, but within. The only focus is on the water distribution up to the street tap, but not on the systems within the buildings.
Wow.
See, that's the problem we're lacking, because they don't extend into the building and plumbing downstream for the treated water public systems. That's why.
So the regulations stop at the street.
Correct, not the buildings.
Wow.
That's where the problem lies.
And we need new regulations to basically take.
Correct, because what happened is basically the protection of our job as a public health official. We need more protection to the public in these building these water systems. These include ensuring the hot water temperatures in the buildings are high enough, requiring a minimum level of disinfectant in public water systems, and offering homeowners more guidance on how to prevent Legionella. Basically, if I can divulge a little bit more.
Please.
Especially the first one I mentioned was these are the following ways we can combat the growth of Legionnaires. But one of them is for all types of buildings, they should be the same for all buildings. Basically, that's the problem where it lies. It's not the same.
It's not consistent.
It's not consistent for every state, not for every city. So basically, we're working. Hopefully, we can work towards making this a same regulation for all buildings. That all buildings, hot water heater temperatures should be maintained above 140 degrees Fahrenheit, and the hot water temperature to distal points, which is basically the fixtures of faucets, shower heads, and thermal mixing blends of hot and cold water, should exceed 131 degrees Fahrenheit. Because these temperature requirements could be modified by changing the building and plumbing codes for residences in other buildings, or by modifying the Centers for Medicare and Medicaid Services memo that affects healthcare facilities. The next one should be the guidance, as I mentioned a while ago again. It's needed for homeowners about practical steps that can be taken to combat Legionella. For example, flushing stagnant water from the taps after periods of disuse may help prevent Legionella. Increasing the water temperature in household water to 140 degrees Fahrenheit. Because if you just let it sit, when you have water, it just sits there. Basically, when you use the hot water, it's not hot enough. You see, that's where the problem arises. Now, and the next one is, important one is also low flow fixtures should not be allowed in hospitals and long-term care facilities because due to these buildings, high-risk occupant population, because there's a lot of people, of course, these low flow.
With low immune systems.
Of course,
Yes.
which is already also a risk.
Mhm.
Low flow fixtures have been promoted to conserve water, even though they're conserve water, they are, and energy as well, they're good, but these fixtures increase water stagnation, which we're trying to prevent. These fixtures increase water stagnation and reduce disinfectant levels of the water, thus presenting a greater risk for Legionella.
Wow, that's amazing.
Yeah.
That's amazing.
Everything.
Well, no, I mean, Doc, first of all, I want to thank you for showing up today with us and basically having this conversation with us in the public health corner. We know our audience really do appreciate it.
Thank
And, we'd like to have you again. It's been an absolute pleasure, Doc.
You're welcome.
And have a good day.
You too.